Hi, my name is Geriann Burrington, and I'm the nurse manager of the Cardiac Surgery ICU at Mount Sinai Hospital. American Heart Association and Mount Sinai Heart want to wish you a happy American Heart Month. In celebration, we would like you to know your numbers. What are these numbers? These four are total cholesterol, blood pressure, blood sugar, and your BMI or your body mass index. These numbers help women and their healthcare providers determine the risk of developing heart disease. Let's talk about cholesterol first. Cholesterol is a waxy substance found in your blood that your body needs to build healthy cells. However, in high levels can increase your heart disease risk and develop fatty deposits in your blood vessels. How do we find out what these numbers are? Make an appointment today with your healthcare provider to have a cholesterol screening. What is a cholesterol screening? This is a simple blood test that checks your levels of LDL, low density lipoprotein, or bad cholesterol, your high density lipoprotein, or good cholesterol, and triglycerides. High levels of LDLs lead to plaque buildup in your arteries and lead to heart disease or stroke. HDL, or high density lipoproteins, HDL, or the good cholesterol, helps you lower your risk of heart disease or stroke. Triglycerides, a type of fat in your blood that you use for energy, and their levels, along with high HDLs or low HDLs, can increase your risk for heart attack and stroke. The total cholesterol is the amount of cholesterol in your blood, so the total of your HDLs, LDLs, and your triglycerides. The next number we'll talk about is your blood pressure. We all have heard of blood pressure, but what does it mean? Your blood pressure is the measure of how much pressure is put on your arteries when your heart pumps blood through your body. Normal numbers are less than 120 over less than 80. What does the top number mean? Your systolic blood pressure is how much pressure your blood is exerting against your artery walls when your heart beats. The bottom number indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. Your diagnosis of high blood pressure must be confirmed with your healthcare provider, and the higher or more elevated your blood pressure gets, the higher your risk for cardiac and vascular disease. Our third number is our fasting blood sugar. Why should you care about your blood sugar even if you aren't diabetic? Over time, high blood sugars cause damage to blood vessels and nerves that control your heart. These high blood sugars might also be a sign of prediabetes, so it's crucial to know them and keep them in check. Adults with diabetes are 2 times more likely to die from heart disease than adults without diabetes. The AHA considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease. Lastly, our body mass index is our last number that we'll take a look at. Your body mass index, or BMI, is the numerical value of your weight in relation to your height. A BMI between 18.5 and 25 kilograms meters squared indicates a normal weight. A BMI of less than 18.5 kilograms a meter squared is considered underweight. A BMI between 25 kilograms meter squared and 29.9 kilograms meters over meter squared is considered overweight, while a BMI of 30 kilograms over meter squared is higher, considered obese. Obesity is recognized as a major independent risk factor for heart disease. The bottom line is that excess weight increases the work of the heart. It raises your blood pressure, cholesterol, and triglyceride levels, and lowers our HDL, or good cholesterol. Diabetes is more likely to develop. Now what? Now that we know these 4 numbers, what do we do? When we know these 4 numbers, we can take action and decrease our risk for developing heart disease. You have to understand your risk factors. While we can't control family history, age, and gender, we can control our blood pressure, smoking, cholesterol, and lack of exercise. Managing our numbers comes with many benefits. When we control these risk factors, we ultimately feel better physically. We can manage our blood pressure and stress by taking part in self-care activities, doing mindful meditation, taking intentional slow breaths, keeping a positive frame of mind, picking up a hobby, and getting enough sleep. Eat better. Make smart food choices. Eat colorfully, fruits and vegetables and whole grains. Manage your portion sizes and keep a food diary to be mindful of your eating habits and understand why we eat the way you do. Get active. Aim for 150 minutes of activity a week. That's just about 2 hours and 30 minutes that could be broken down over days to make it more manageable. Move more with intensity and sit less. Wear a Fitbit. Lose weight. Set up realistic goals, small short term goals, which are more achievable and keep you on track. If you invest in the strategies already mentioned, this won't be so hard. Aim for I'll lose 3 to 5% of my body weight. And lastly, stop smoking. If you haven't started, keep not smoking. Thank you for joining me today. And once again, happy Heart Month. Remember, knowing your numbers, cholesterol, blood pressure, blood sugar, and your BMI will help you to take action and manage your heart health. Schedule an appointment with your healthcare provider for any questions.